Welcome back to Desk Careers. I am so excited to bring another incredible guest. This morning, we're meeting with Dr. Hassan Galadari, who I like to describe as our local cosmetic dermatologist celebrity. Dr. Galadari is not only a practitioner, he's also an assistant professor at the College of Medicine and Health Sciences at the UAE University. He's American board certified dermatologist. He is described as the avant-garde and connoisseur of beauty and the finer things of life. Good morning, Dr. Galadari. How are you?
Good morning, Maria. I'm very well, thank you.
I'm so excited to bring you here and talk about your incredible journey from being a young student here in Dubai to going across to the US and then coming back and working with clients and patients and also being an assistant professor. I don't know where to begin. I mean, I have so many questions, but I'm kind of thinking, do I start here? Do I start there? So I'm just going to start right when you were a young teenager. I want to take you back to those days when you were studying at Al School. Do you remember being that young and thinking, oh, what do I want to be when I grow up? And what do I want to do? I'm sure you had lots of people asking you. Do you remember those times?
Absolutely, and I do remember very well. And I keep on remembering this because, my kids go to the same school. So every time I walk onto the campus, it takes me back to where it all started. This has been going on for my eldest, who's just finished high school, actually. So he's graduated, and now also with my other son and my girl who also goes to school. So yes, so. Every time I go there, I'm taken back, and I remember the days that I was walking the halls. And now everything appears to be so small. And in the beginning, it used to be just so big. I mean, you'd walk the hallways, and you're like, "Wow, the classroom looks so big." But now I walk into the classroom, and it's just like, "Really? This used to be my classroom? It's quite small." But it just tells you it's not just because physically I've grown, but at the same time also. Socially, emotionally, mentally, the growth aspect has occurred from since I would say the early 90s when I was in school until today. So that's where it all started, and I always keep on telling myself that that's where the passion or the fire kind of started to kind of burn, and it's still burning, I can say, Maria.
So I'm listening to you and I'm just in awe of not just your journey, but of your confidence as you retell this story. And I know listening to this will be one of our younger students or a young person in our community here in the UAE or even abroad. And they'll be listening to this thinking, yeah, of course, he's really happy about looking back, but it's really hard to be young right now, and wanting to be a doctor is a very scary experience for many, many students. Do you remember thinking about medicine and how did you know that was what you wanted to do?
All right. First of all, Maria, for all the students who are out there, I have to tell you, I may sound confident now. I may sound like, presentable. My voice is a little bit too strong and too gruff or so forth. But I really started as I consider myself a painfully shy boy. I really shunned, social gatherings, things that, all the different things that were happening in school. I wanted to be part of the extracurricular stuff, whether it was, the being on stage or whether it was, just being a part of the group. But I was pretty much a geek. And it was, for me, it needed that extra push. And you'll get there. So all students who feel that way should not feel the fact that that this is something that's going to hold them back. It's going to take some time, and it's going to make you it will make you a better person at the end of the day. But you definitely need to work on yourselves, and this is exactly what has happened to me. As for when did I start liking medicine? I would say since the beginning. Given the fact that I'm pretty much introverted, so I kept on looking at myself all the time. How do the hands work? How do the eyes work? I would look at for example, the mirror, and I would see my pupils, and I would say like, okay, the iris looks great. It's brown, and then I would shine light, and I would see it like, constrict, and I'm going like, this is interesting. So there's just this interest of how the human body works has always been there since the beginning, and that's the reason why I really got into medicine at the end of the day.
Why dermatology? Why not any other type of medicine?
Yeah, that's also a good question. I'm a very visual person. I like the visual arts. I like, going to museums, seeing paintings. I still to this day, and this is, I'm admitting it to everybody, I still read comic books. So, I mean, when I read, I like the visual aspect of things. So dermatology for me, at least as a medical specialty, is an extremely visual field of medicine. You see the actual condition on a person's, whether it's the body, whether it's the face, whether it's the extremities or anything, and then you also see and that's the best part. You see the treatment and the treatment effect on the person once it's being administered, and this is something that I truly enjoyed. It's extremely fulfilling. I'm not taking anything away from cardiology, say for example, or which is the study of the heart. But at the same time, those other specialties deal with numbers. Oh, their cholesterol is high. Let's give him, a medicine, and his cholesterol is going to go low. You can't really see the cholesterol, but you can definitely see the acne. You can see the eczema, and that's exactly what I wanted to see. I wanted to see the results of my treatment on my patients.
And I believe, and correct me if I'm wrong, but what you do is so much bigger than the aesthetic part of it. I believe that the work that you do has a great impact on somebody's self-esteem and somebody's self-confidence.
Absolutely. I mean, everybody knows that, especially during the teen years, in which you are really kind of trying to, you're forming your personality. You need that. Think about it this way. I mean, as a child, before your preteen years, you're just moving around with everybody and so forth. It's not you. You're not looking at yourself. But once you get into your teen years, the effect of hormones and so forth, you kind of start kind of looking more into you. And when you start looking into yourself, and then you look at for example, your face, and you go like, why is my nose getting bigger? Why is my hair getting coarser? Why am I developing pimples all over my face? That sometimes can take away from your confidence, from self-esteem. It doesn't allow you to kind of be a part of a group, given the fact that these changes are occurring on your body. And it's extremely important is that when you treat such individuals and they get better, you can definitely see that their quality of life and their confidence just boost up. And this is something that's been published many, many times in scientific research articles.
Amazing. And would you say that when you introduce yourself to the public, there's like varying opinions, aren't there, about cosmetic dermatologists? There's like, yeah, why did you really go into this? Or, is this really something that we need? Everybody seems to have an opinion. How do you respond to those things when young people think, I do want to go into this, but I'm not sure how my peers or my friends or my family might react to my decision to do this type of medicine?
Well, I'm a dermatologist first and foremost. So, I mean, dermatology deals with a lot of aspects. It could be medical dermatology, in which you're dealing with certain conditions, as I mentioned, such as acne, psoriasis, eczema, vitiligo. So, for me, that's the most important thing. I still see children. I mean, even though I've subspecialized in the cosmetic aspect, but I still do see kids. And I take care of kids who have skin conditions. So for me, I mean, being a cosmetic dermatology is important as a subspecialty at the end of the day. But for me, I mean, being a dermatologist is what I am. So if anybody who's out there who wants to get into that field, you are going to be a dermatologist, and then you get to choose whether you want to be a surgical dermatologist, a medical dermatologist. You get to be that subspecialty. So it's, you take it a little bit further, and it depends on what you like. I kind of like the cosmetic aspect of things, because it has a lot to do with the visual arts, as I mentioned, and looking at people's faces and how they kind of the ratios between one aspect to the other. I enjoy that. But if you don't, still you can do other things in the field of dermatology that you will definitely like.
Fantastic. All right, let's go back on a journey of your academic studies. I know listening to this right now, we will have young people who are thinking about, where in the world do I want to study? And many young people, what I've seen in my experience and working with them is they're trying to choose the university that they believe will make them stand out. But in looking at all of your options and all of the places that you studied at, they're all very different and they have a different flavor, different element to them. Would you say that young people should be paying attention to where they want to study, or more importantly, to just going somewhere that is more of a connection to the bigger picture of the university aspect?
Okay. Well, I'll take you back. I mean, I have to admit, when I was studying at the, when I was in school and I knew I was getting into medicine, I felt that I wanted to, to study abroad. I'm going like, I want to go study abroad. That's where you get your best, teaching, your best education. My parents would not allow that. I mean, they thought this guy just finished school. He's 17 years old. We're not going to send him out. He's definitely going to stay here. And at that point, we're talking in the mid 90s. The only college of medicine at that stage was the one at the UAE University, and that's where I got enrolled. And I was like I still remember myself. I was so bitter. I'm like, I wanted to go out abroad. I wanted to do this. It's something. Like a chip on my shoulder, or something that I really wanted to do, but I never got the chance to do it. So what I thought to myself, I'm going to make the best out of this. This is the most eminent university that we have at that time. It is the best college of medicine that we have at that time. So what I'm going to do is that I'm going to be the best student in the best college that we have in the country. And that's going to make me shine, to make me want to achieve what I wanted to do at the end of the day. And that's exactly what I did. So as I enrolled into the university, I graduated with honors, and I was the first in my class. And I did that from all the different stages. So it's a 6-year program, and every year I was the first in my class, and I graduated the first in my class. And during this time, I was always preparing for what would the next step be. And for me, that was going to the US. And, there are different exams, the equivalency exams that you have to do to be able to do that. And that's exactly what I did. And once I graduated, I had all the different, at that stage, I was in my mid-20s. It takes a long time for you to kind of finish medicine. At that stage, my parents would not be able to tell me, no, you can't, we're not going to let you go, because that's it. I'm a grown adult now. And at the same time, I had all the necessary qualifications that will allow me to do so. So what I would like to tell all the students who are out there, make the best of the current situation that you're in. And, keep that, don't feel let down. I mean, a lot of people will say like, hey, I never got to achieve what I wanted to, so I'm not just going to do it. I'm just going to keep on forgetting and just keep on moving. If you really want it, you just work to it. It's not going to happen immediately. For me, it happened probably after with internship, 7-8 years after. But at the end of the day, it did happen. And it's something that, I've checked off my list. If you ask me now, would I want to go study in the US? I'll tell you, no, I've done that. I just don't want to do this anymore. So, to all the students, just keep that in mind. Just don't feel let down. The world is going to try to keep you let down. But, this is one of the things that one of my favorite quotes out of Rocky, the movie. And he kept on saying that the world is going to keep pushing you down. But all you need to do is you keep punching. And, and you just, you will make it at the end of the day.
I'm just taking that in. That is such a great, I haven't heard that for a long time. That is a great quote to remember. Tell me about the difference between studying in the UAE and studying abroad. I mean, I know it's very hard. I think students forget that it's not just studying in a different country. It's a whole cultural change, isn't it? It's an entire experience. What was that like for you?
So, I mean, studying in the UAE is something that's easy. I mean, you're in the same, ecosystem that you're used to since you were in school. So it's just pretty much more, I would not call it the same, because, university life is different, the way that the courses are run, the way that things are put together. So, but after you're done, you're going back home. So you've got somebody who's going to be doing your laundry. You've got somebody who's preparing your lunch. So all of this is kind of, in a sense, you're sheltered. However, if you're going to be going to anywhere abroad, we're not just the US, the US or anywhere else, you're not just a person who is studying. You're not only a student. You're a person who has to do their lunch, who has to do their beds, who has to do, their laundry. And oh my God, the laundry was horrendous. Nobody wants to do that. But, all of this, has to be put together, which can take away the focus out of your studies. So, people who are staying here should feel blessed that they are going to be here, because you have all the other stuff that's being taken care of, and really are able to focus mainly on their studies. And this is something that I felt, blessed about. And now looking back, I wouldn't want to change it. I feel that I was too young to actually go abroad, have all of this be dumped on me, and at the same time finish as a doctor. I could have done it, but it would have taken me a little bit too long. There was just a little bit more pressure for me to actually do that. I needed to be prepared. And maybe being here probably helped me prepare a little bit better. So once I did go there, I felt, I was ready.
So much fun to think back. What would you say that until this point, and you've done so many things, from being a practitioner to being a professor, you're a Secretary General for the International League of Dermatological Society. I mean, you're wearing so many hats. You're a father, you're a husband, you're a friend, you're a son, so many hats that you wear on a daily basis. What would you say have been the highlights this far in your career?
The highlights. I mean, I would say at the end of the day, it's the family. I'm a very family oriented person. So I mean, they're the ones who keep on grounding me. I mean, you could be you could be this, and you could be that, and you could be like the president of this society, or you could be like, the dean of this college. But at the end of the day, I mean, you're coming back home. And, the best thing about coming back home is to get to see the family, get to see the kids, seeing how they've been doing that, through their days. Now that, my daughter's in school, to getting to know how she's spending her time in school. And, it takes you back. I mean, with all the different achievements at the end of the day, that, it takes you back for you to think that's exactly how you started. You started as this little person who was getting ready to go to school, putting their shoes, probably feeling a little bit grumpy or maybe a little bit sleepy. So it makes you also feel fulfilled that, at the end of the day, I mean, you have achieved your goals. I mean, you were able to do that. And you would want also your children to kind of also get the chance, at least, to be able to fulfill their dreams. So for me, I mean, that really is what makes it all worthwhile. So if you strip away everything, I would rather be a father, a husband first. And I'm not saying that because my wife is sitting next to me, but that's what I would choose first. And then, I would be the career person that I am.
Amazing. I love that you bring it back to family. I think many parents watching this right now they're thinking about their children and wanting the best for their children, and wanting to help them. And it's this very fast-paced journey right now, especially when they get closer to graduation and university applications. What are you going to do? It's constantly living in the future. But for young people, they are on such a quick pace moving forward that they forget that they always come home. So I love that you brought that back, because I do believe that we should stay humble and remember those grounding features. So let's talk about the module that you described as one of your favorites. You said that you are the coordinator of a module that pertains to skin and muscles for fourth year students, as well as the medicine clerkship. So for me, that's like, what does that really mean? And I know that a young person thinking about this career path might be very interested. Can you tell us more about that?
Yeah. So the way that the medical studies is actually kind of organized, the College of Medicine, is that, you have in your first 2 years, you're learning your basic anatomy, physiology, pharmacology, and so forth. And then in the the third and fourth years, everything is kind of put together in organ systems. So, for example, you're talking about the cardiovascular system, the pulmonology system, and all the GI system, and then one of the systems is the musculoskeletal system. So the musculoskeletal system, pertains to the muscles, and also we kind of add the skin there as part of it, as part of the integumentary system. So I take care of that. So I make sure that the scheduling is kind of put together in the right order, so that the students get the best out of the module in terms of the teaching. So in addition to putting together the exams, hence the reason why a lot of the students don't like me, because I usually I try to make it, I am very, very fair. So I try to make it as fair as possible. But at the end of the day, it is for their own benefit. So that's important. Make sure that if there's any student, for example, who is absent, find out exactly why they're absent. See if there's anything that you could do in terms of remediation and to help them to kind of pass and get the best out of this module. So that's going to be one thing. And then, in the clinical years, I'm also involved in putting together the same thing for the clinical years. So, in their terms of their clinical experience, whether it's in the hospitals or in the clinics, and also doing the exact same thing, whether, in terms of assessments that we have. And the assessments is very, very different from the beginning or the formative years until their clinical years. The assessments as they get older in their clinical years is pretty much very much work-based. So we get to see them in clinic settings and how they kind of interact with patients, which is different than just kind of like going through a paper and just choosing the right answer. So everything is a little bit different in that sense. And that, for me, that's, being involved in this really is kind of nice, because you get to see the exact same students that you taught in their fourth year, and at the same time, experiencing how they've matured in their final year. So, and it's amazing the progress that they go through. It's just like, seeing your children actually going through the exact same thing. So it's very, very wonderful in that regard, and I truly enjoy it. I hope the students are enjoying it too.
I'm sure they are. Tell me about your ideas for young people that need to be gaining work experience. This is a big topic for our secondary students. They're really concerned about applying to university, writing their letters of application, thinking about how are they going to stand out. There's this assumption that they're competing with the pool of students in their own school, when in fact they're really competing with students from all over the world for a few places at university. So they're really wanting to stand out. Unfortunately, in the UAE, it's very challenging for a young person to get clinical experience and shadow doctors. But I'm listening to you talk to me about what you do and the different roles that you are doing in your life as a doctor. And I'm beginning to wonder, should they only be thinking about gaining work shadow experience in a clinic, or should they be doing other transferable skills and practicing those things that would help them stand out even more?
So think of it this way. I mean, this is all very, very important. So in terms of, the work experience and so forth. But remember, if you're going to be competing, if you want to get into medicine and you're going to be competing with other individuals, there are two ways in which you can do this. Either compete in a sense that you are going to be part, for example, you volunteer in a hospital somewhere, or shadow a doctor and so forth. But you're going to ask yourself, what am I getting much out of just shadowing a doctor or shadowing a person? You're kind of basically skimming on how things are. You want to make sure that whatever it is that you're volunteering for, you're actually kind of gaining, in a sense, not just basically that type of experience of just shadowing, but at the same time, you're actually doing something. And I think that helps the student be able to kind of write more about in their, for example, letter, and that will kind of make them shine even more. So, for example, I'll give you an example. Instead of just saying, "Oh, I shadowed Dr. X since this," and then that doctor is like really preeminent and everybody knows him, but then you're just only shadowing. Did you get to do much? But for example, if you were involved in volunteering in a blood drive, say for example, and you were part of the whole, you went into the car and you were making sure that people are coming in and so forth. That is, for me, as a much more fulfilling experience or volunteer work. In addition, it will make your letter even stand out more because you're actually doing something. So the more you do, the more any volunteer work that kind of is a little bit more practical, that makes you kind of work for it, makes your letter shine a little bit differently. And always be true to yourself. I mean, everybody's got, if you look at all these different letters, they're all pretty much the same. The letters that do stand out are the letters that, that show that there was an extra level of interest, and also that are, I don't want to call them quirky, but at the same time, they just stand out because really somebody actually did that. It also blows the person who's reading the letter away. And that's the type of letter that we are looking for in terms of having our students kind of join in. And so that's basically it. Find something that you would want, that you are going to be doing. So like I said, either blood work or lab, or even for example, research. Be involved in that sense, so that when you talk about it in your letter, you're going to be much more passionate about just stating it, because you've actually done the work yourself. And that's it.
Amazing. I know that you said if you're enjoying it, it's not work. What does that mean when you think about your career?
Yeah. I mean, people tell me, you work too much. I tell them I don't work too much. I mean, this is I'm enjoying it. I mean, people are used to this whole concept of, you're going to work and then you're coming back and they're punching in and punching out. For me, there's no punching in, punching out. It's just, I'm enjoying this right now. So I don't see that it's a burden for me. And then, after this, I've got another meeting and I'm going to, I know I'm going to enjoy that meeting. So if you're enjoying something, it doesn't feel like work. Unfortunately, the concept of work has always come with negative connotations. And people think, oh, I'm just, I need to finish this because I need to finish it and it's work. I need to finish it because I actually like doing it. So that's the whole difference. And this is something that it's not only in just medicine, and a lot of the things that students should be doing. If you really enjoy teaching, if you're enjoying, if you have a law firm and you're enjoying kind of making sure that everything in your law firm works, or if you're, anything that you do, if you're truly enjoying it, and it becomes not part of work, it just becomes part of who you are, and it becomes a much easier way to kind of spend the whole day. You don't feel that burden that you're going to be stuck in a cubicle somewhere until a certain time for you to leave back home.
So true, and I can resonate with that completely. With shows like Grey's Anatomy, The Good Doctor, so many medical shows that are on TV, there's an idea or a fantasy of what the world of medicine would be like. What do you know about the world of medicine that these shiny TV stars are really, really not demonstrating properly?
Well, I gotta say, the from all the different TV shows, for me at least, the one that was the most truthful in terms of how medicine was, there were two of them. I grew up on ER, and then when I kind of finished and got into medicine, it felt a little bit like that. But then really the one that's the most authentic was Scrubs. If you guys remember Scrubs is really exactly how residency training is in hospitals was. That's exactly how you would interact with your fellow residents, and the fun shenanigans that you would go through. So Scrubs for me, from all the different ones, is pretty much the most realistic.
Okay. All right. I know that you said be patient, you need to work in a team, and if you think you can build it. Why are those your top 3 career tips for a young person?
You see, you can't, you can work on yourself even if you are just one person. There's so much that you can do. And, as I've grown, when I was a kid or when I was training, I was pretty much a perfectionist, and I would want to make sure that I wanted to do this because I knew that I was going to do this the right way or my way. But then as you kind of mature a little bit, you have to learn how to delegate. And being a successful person in the field, you are able to identify the right person to do the right job. And once you identify that person, you really don't have to kind of, hover over them to make sure that they're doing, their job correctly. You should feel confident that they are going to be doing it. You're going to oversee it at the end of the day, but you don't kind of, follow through the whole little small details. Just make sure that you're doing it. So it is a teamwork at the end of the day. If you are, for example, in the hospital, one person is not going to be able to do everything. I have to admit, the nurses do more than any of the other doctors do. And, they run the wards for us. Like when I was training, they're the ones who, we just say yes ma'am, and like she said like order a complete blood count and order like in your analysis, yes ma'am, whatever it is that you want. So she knows how, what patients want. So you don't don't look down on your fellow teammates, for example, such as nurses or nurse practitioners or even the phlebotomist who draws blood. Trust me, they know how to draw blood better than any doctor that is out there. They will find that vein no matter how hidden it is. So it is at the end of the day a teamwork. You're not the best person, and you're not kind of put on a pedestal just because you have that little DR in front of your name. So know your place, play with the team, and you definitely it's going to be for your, not just for your benefit or the team's benefit. It's actually going to be for the patient's benefit.
Fantastic. I had such a fun conversation with you. Thank you. I could ask you many more questions, but I know we need to bring it to a wrap. You're a very busy doctor, lots of things to do and children to take care of and get you on your day. Thank you for being here with me, Dr. Hassan. It's been such a pleasure. And that brings us to the end of another incredible conversation. Today, we were speaking with Dr. Hassan Galadari, who is an American board certified dermatologist, an assistant professor of the College of Medicine and Health Sciences at the UAE University, and of course, an incredible role model for our younger aspiring medics. Thank you for watching, and we'll see you all at our next Desk Careers Digital Spotlight.